Ceasing the use of the penis in old age can result in various significant health risks related to intimate well-being. As we age, our bodies undergo a myriad of changes, many of which can subtly influence aspects of our health we might not immediately consider. One such area, often shrouded in silence yet profoundly impactful, is intimate health, specifically the consequences of reduced sexual activity in older age. The penis, much like any other part of the body, thrives on regular use and stimulation. When sexual activity diminishes or ceases altogether, a cascade of physiological and psychological changes can unfold, each compounding the other in ways that may not be immediately apparent but can significantly affect quality of life. Understanding these changes isn't just about preserving sexual function. It's about maintaining overall vitality, emotional well-being, and the intricate balance of bodily systems that contribute to a fulfilling life. Consider the gradual decline in blood flow, a natural part of aging but one that's exacerbated by inactivity. The penis, reliant on robust circulation for erections, begins to show the effects of diminished blood supply. Oxygen and nutrients, once freely delivered to penile tissues during regular erections, become scarce. Over time, the body, in its relentless efficiency, starts replacing the smooth muscle tissue essential for firm erections with collagen. Collagen, while structurally supportive, lacks the elasticity of muscle. This transition isn't merely a matter of losing flexibility. It's a fundamental alteration in tissue composition that can lead to difficulties in achieving and maintaining erections. Imagine a garden hose left unused for years. It becomes stiff, brittle, and less responsive to the flow of water. Similarly, the penile tissues, deprived of regular engorgement, lose their suppleness, setting the stage for more severe complications. But the repercussions extend beyond mere physiology. The mind-body connection plays a pivotal role here. When sexual desire wanes, whether due to emotional distress, hormonal shifts, or the weariness of chronic stress, the psychological toll can be profound. A man might notice his body no longer responds as it once did, not just physically but in the waning of that visceral, almost instinctual pull toward intimacy. This isn't merely a matter of libido. It's a complex interplay of neurotransmitters, hormones, and emotional states. Stress, for instance, triggers the release of cortisol, a hormone that, in excess, suppresses testosterone production. Testosterone, the cornerstone of male sexual health, governs not just desire but also energy levels, muscle mass, and even mood. When cortisol dominates, the delicate hormonal balance tilts, leaving men feeling fatigued, disinterested, and emotionally detached, a state that further distances them from sexual activity, creating a self-perpetuating cycle of decline. Relationship dynamics add another layer of complexity. Conflicts, unresolved arguments, and emotional distance can erode the foundation of intimacy long before physical symptoms manifest. Imagine a couple who, after decades together, finds themselves entrenched in routines that leave little room for spontaneity or connection. The once easy banter gives way to silence. Shared moments of affection become scarce. This emotional chasm doesn't just dampen desire. It rewires the brain's association with intimacy. The brain, adept at forming neural pathways based on experience, begins to link the concept of sex with tension or disconnection rather than pleasure or bonding. Over time, this mental shift can make the very idea of intimacy feel foreign or unappealing, even if the physical capacity remains intact. Rebuilding this connection requires more than just physical intervention. It demands open communication, vulnerability, and a willingness to confront underlying issues, a process that can feel daunting but is essential for reclaiming a shared intimate life. Grief, too, casts a long shadow over sexual health. The loss of a loved one, a partner, a family member, a close friend, can plunge a person into a state of profound sorrow where the thought of physical closeness feels incongruous, almost disrespectful to the memory of the departed. The body, steeped in grief, prioritizes survival over pleasure, redirecting energy away from non-essential functions like sexual desire. This isn't a conscious choice but a physiological response to emotional trauma. The emptiness left by loss can linger for years, during which the body adapts to a new normal devoid of sexual activity. The fear of experiencing such pain again, of opening oneself up to vulnerability, creates an invisible barrier, making the return to intimacy a slow, tentative journey. Support groups, therapy, and gradual re-engagement with social connections can help bridge this gap. but the path is often nonlinear, requiring patience and self-compassion. Serious illnesses, particularly those requiring aggressive treatments like chemotherapy or radiation, introduce another dimension of challenges. The physical toll of these therapies is well documented: fatigue, nausea, hormonal imbalances, and a general depletion of vitality. But the psychological impact is equally significant. A man battling cancer may find his self-image altered, his confidence shaken by changes in his body or the side effects of treatment. Medications designed to save his life might inadvertently sabotage his sexual health, suppressing testosterone or impairing nerve function. In this context, sex understandably recedes as a priority. Survival and managing day-to-day well-being take precedence, and the body in its wisdom allocates resources accordingly. Yet this necessary focus on health can inadvertently lead to neglect of sexual function, which, if unaddressed, may result in long-term complications. Open dialogues with healthcare providers about these side effects, coupled with integrative approaches like pelvic floor therapy or hormone monitoring, can help mitigate these effects, preserving both health and intimacy. The modern workplace, with its relentless demands, also plays a role in this intricate tapestry. Chronic stress from overwork triggers a cascade of hormonal responses: elevated cortisol, diminished testosterone, that directly inhibit sexual desire. The mind, perpetually occupied by deadlines and responsibilities, struggles to shift gears into a state of relaxation conducive to intimacy. Physical exhaustion compounds this issue, leaving little energy for anything beyond the bare essentials. Over time, the brain begins to associate the bedroom with stress rather than sanctuary, further entrenching the cycle of disinterest. Breaking free from this pattern requires deliberate effort. Setting boundaries around work hours, engaging in stress reduction practices like mindfulness or yoga, and consciously carving out time for connection, even if it initially feels forced. Small, consistent steps can gradually rewire the brain's associations, fostering a renewed sense of balance. Hormonal changes, particularly the decline in testosterone during andropause, represent a biological inevitability, but not an insurmountable one. Testosterone's role extends far beyond libido. It influences muscle mass, bone density, mood regulation, and cognitive function. As levels dip, men may notice a constellation of symptoms: reduced energy, weight gain, irritability, and a diminished interest in sex. Medical interventions such as testosterone replacement therapy, TRT, offer a potential lifeline, but they're not without controversy. While TRT can revitalize sexual desire and physical vitality, it carries risks, including cardiovascular strain and prostate issues. Thus, a nuanced approach, combining lifestyle modifications like strength training, which naturally boosts testosterone, a nutrient-rich diet, and regular medical monitoring, is often the safest path. Additionally, exploring non-hormonal avenues such as mindfulness practices to enhance present-moment connection during intimacy can complement medical treatments, fostering a holistic approach to sexual health. The consequences of prolonged sexual inactivity are both immediate and insidious. Reduced oxygenation of penile tissues, as mentioned earlier, sets the stage for structural changes. Collagen infiltration leads to fibrosis, a condition where the penis becomes less pliable, potentially developing fibrous plaques that cause curvature, Peyronie's disease. This isn't merely a cosmetic concern. It can render intercourse painful or impossible, eroding self-esteem and relational harmony. Preventative measures, however, are within reach. Regular use of a vacuum erection device, VD, can mimic the natural engorgement of an erection, promoting blood flow and tissue elasticity. Think of it as physical therapy for the penis, a way to maintain vascular health even in the absence of regular sexual activity. Pairing this with Kegel exercises, which strengthen the pelvic floor muscles crucial for erectile rigidity, creates a powerful synergy. These exercises, simple yet effective, involve repeatedly contracting and relaxing the pelvic muscles, a routine that can be done discreetly anywhere, anytime. Penile atrophy, another consequence of disuse, manifests as a reduction in both length and girth. This occurs as the smooth muscle tissue atrophies from lack of stimulation, much like a limb in a cast loses muscle mass. The psychological impact of this physical change can be profound, fueling anxieties about sexual performance and body image. combating atrophy requires a proactive approach. Beyond mechanical devices like VEDs, topical treatments such as platelet-rich plasma (PRP), injections or shockwave therapy are emerging as innovative solutions. These therapies stimulate tissue regeneration and angiogenesis, the formation of new blood vessels, offering hope for those seeking to reverse the effects of long-term inactivity. However, their efficacy varies, and consultation with a specialist is crucial to determine suitability. Erectile dysfunction (ED), perhaps the most recognized consequence, is both a cause and effect of reduced sexual activity. The less the penis is used, the more challenging it becomes to achieve erections, creating a feedback loop of frustration and avoidance. Pharmaceutical aids like tadalafil Cialis or sildenafil Viagra remain cornerstones of treatment, enhancing blood flow by inhibiting the enzyme PD5. Yet, medications alone are seldom a panacea. Addressing underlying factors, whether psychological, hormonal, or vascular, is essential. Cognitive behavioral therapy (CBT) can help reframe negative thought patterns around performance, while lifestyle changes like smoking cessation and improved diet, rich in antioxidants and nitric oxide-boosting foods like leafy greens and beets, support vascular health. For some, the integration of mindfulness-based stress reduction (MBSR) techniques can alleviate the anxiety that often accompanies ED, fostering a more relaxed and present approach to intimacy. The interplay between mental and sexual health cannot be overstated. Depression, anxiety, and chronic stress are not just bystanders in this process. They are active participants, exacerbating physiological declines and creating barriers to seeking help. The stigma surrounding male sexual dysfunction often prevents men from discussing their struggles, even with healthcare providers. Normalizing these conversations, through public health campaigns, supportive communities, and empathetic medical care, is vital. Encouraging men to view sexual health as integral to overall well-being, akin to heart health or mental health, can dismantle these barriers, fostering earlier intervention and better outcomes. Preventative strategies too warrant emphasis. Regular sexual activity, whether through intercourse, masturbation, or the use of mechanical aids, acts as a maintenance regimen for penile health. It's akin to exercising a muscle, use it or lose it. For those without a partner, self-stimulation remains a valid and effective means of preserving function. Moreover, exploring non-penetrative forms of intimacy, sensate focus exercises, mutual massage, or simply spending quality time with a partner, can sustain emotional and physical connection even when traditional sexual activity is challenging. Lubricants and erotic aids can enhance comfort and pleasure, reducing friction-related discomfort that might deter activity. Nutrition and exercise play foundational roles. A diet rich in omega-3 fatty acids, zinc, and L-arginine supports vascular health and nitric oxide production, crucial for erectile function. Regular aerobic exercise improves circulation, while strength training boosts testosterone levels. Even moderate activities like walking or swimming can yield significant benefits. Hydration, often overlooked, ensures optimal blood viscosity, facilitating smoother circulation. Avoiding excessive alcohol and quitting smoking are non-negotiable. Both constrict blood vessels, directly undermining erectile capacity. In the realm of medical interventions, advancements continue to broaden the horizon. Penile prostheses, once considered a last resort, have evolved into sophisticated devices offering naturalistic function. Testosterone patches, gels, and implants provide alternatives for those with clinically low levels. Emerging therapies like gene editing and stem cell treatments hold promise for regenerating damaged tissues, though they remain in experimental stages. The key lies in personalized care, tailoring treatments to the individual's unique physiological and psychological profile. Ultimately, the message is one of empowerment. Aging need not herald the end of a vibrant sexual life. By understanding the risks of inactivity, recognizing the multifactorial nature of sexual health, and embracing a proactive, holistic approach, encompassing physical, emotional, and relational well-being, men can preserve and even enhance their intimate health well into their later years. Education, open dialogue, and timely intervention are the cornerstones of this journey. As society shifts toward a more inclusive and candid discourse on aging and sexuality, the stigma surrounding these issues will continue to erode, paving the way for healthier, more fulfilling lives. In closing, the importance of maintaining sexual activity in old age cannot be overstated. It is a vital component of holistic health, intertwined with physical vitality, emotional resilience, and relational harmony. By addressing the root causes of sexual decline, be they physiological, psychological, or situational, and employing a combination of medical, mechanical, and lifestyle strategies, men can reclaim agency over their intimate lives. The journey may require patience, courage, and a willingness to seek help, but the rewards, a sustained sense of connection, vitality, and self-confidence, are immeasurable. Let this be a call to action, to prioritize sexual health as zealously as we do other aspects of well-being, to foster open conversations free of shame, and to embrace the possibilities of aging with grace, knowledge, and proactive care.